found that, there was no significant difference in ischemic stroke risk between the two at 30 days and 180 days. There were fewer ischemic strokes with anticoagulation compared to antiplatelet, but these differences did not achieve statistical significance. We also found that major bleeding was non-significantly different between the two within the first 30 days, but up to 180 days, anticoagulation had a significantly higher risk of major bleeding compared to antiplatelet therapy. So, based on these results, we would generally suggest that, if any treatment is reasonable and if a provider picks anticoagulation, then they should consider stopping anticoagulation by day 30, especially that the majority of ischemic strokes that happened, they happened within the first 30 days. In our study, 87%, and similar numbers in other studies as well. We also found that patients with occlusive dissection and an occlusion, they had a significant benefit from anticoagulation. So, with these patients, again, if it's safe to treat them with anticoagulation, then that would be preferred than antiplatelet therapy, at least, based on the results of our study. So, I think looking at the, patient in general, looking at the risk of stroke, looking at the risk of bleeding, and trying to balance these two risks would, be very helpful in picking what the right treatment is for each patient. So it may not be a one treatment for all approach. It may be, more of an individualized treatment based on, the risk of stroke and the risk of bleeding.